Good Thursday afternoon, everybody. Today is Thursday, September 17th, and I wanted to take a little time to provide an update about the COVID-19 situation in Chesterfield County. Again, I'm Dr. Alex Samuel, Health Director of the Chesterfield Health District. All of the data that I'll be talking about today comes, as usual, from the COVID-19 data web pages, which can be accessed at www.bdh.virginia.gov. One of the key indicators that we've been following throughout at the locality level that helps us understand the course of COVID in the population is the number of new cases per day. Over the past 2 weeks, we've seen a drop in cases to roughly 25 new cases per day, and then an increase in cases more recently to around 42 cases per day. And then in the past few days, followed by a drop back to close to 35 cases. And this circles back to where we were 2 weeks ago. The recent increase could very likely be due to exposures that occurred over the Labor Day weekend. Overall, we haven't seen any major focal points to account for these cases, such as major outbreaks. Percent positivity is another metric that we follow that we've talked about over the past several broadcasts, which is essentially a measure of testing capacity. So I mentioned before that 10% percent positivity is a value that we wish to get below. Chesterfield Health District, which includes Powhatan County and again the city of Colonial Heights, is currently at 6.2%, which means we're headed in the right direction. The lower, the better. 5% positivity has been mentioned in some public health quarters as a target value. To put this in perspective, the US is currently at 8% positive. Hospitalizations are a lagging indicator of disease burden. So far, hospitalization numbers at the county and regional level haven't shown any significant changes over the past several weeks. If indeed the recent bump upwards was due to an increased exposure over the Labor Day holiday, that directly speaks to the behavioral factors that are at the root of the transmission of this virus. By way of an aside, we have seen similar bumps upward over the Memorial Day weekend as well as July 4th. So folks coming together, perhaps disregarding the social distancing guidance and mask wearing guidance are very likely a factor in an increase in cases that we see on a transient basis. So remember, everyone, you should be practicing the 3 W's, which includes watching your distance, maintain a social distance of 6 feet, wear your face covering, and wash your hands. These are simple steps that work, and right now, they're our best defense. I'll close by reminding everyone that the health department provides free COVID-19 testing to individuals who are symptomatic, and we're prioritizing testing for those who otherwise would have challenges accessing testing. We don't offer the testing at our health department locations. However, we're providing it at various other spots throughout the county. To learn more, you can call our coronavirus hotline at 804-318-8207. Visit our district website at www.bdh.virginia.gov/Chesterfield, or visit the VDH website at bdh.virginia.gov, then navigate to the COVID-19 data page where you will find a link for testing sites. Both websites indicate locations and are kept up to date. Thank you, stay safe and stay well.